That is the actual implication of your study, is that you are better off just asking ChatGPT and not your doctor.
That's not my conclusion from the study. You have to engage with this technology. It's going to change every single white collar field. We're like the ultimate white collar field. It's going to change our field. So if this thing can do a better job than me at making my patient's life better, to me, it seems like that's what the right thing to do is.
Well, Casey, it's time for your annual checkup.
Oh, my goodness. You know what? You're joking, but I actually do have my annual checkup later today.
Wait, really?
Yeah, I do.
You're going to the doctor?
That's right. It's time to find out what's going on with this old body, Kevin.
Well, just from looking at you, I would say you're not getting enough vitamin D.
Well, I was recently diagnosed as handsome.
I think you need to get a second opinion on that. But Casey, I want to talk today about AI and medicine because there was a thing that caught my attention recently. My colleague at the New York Times, Gina Colada, wrote a story about a study that came out a few weeks ago over at JAMA, the Journal of the American Medical Association, which showed that on average, at least in this study, ChatGPT was better at diagnosing illnesses than doctors, even doctors who had access to ChatGPT.
And why that's so fascinating to me is for decades, people have been turning to WebMD to do something very similar, and mostly, it seems, getting the wrong answer. Or certainly the people posting online said, oh, I typed these 3 symptoms into WebMD, and, it told me I was dying. That is not what appears to be happening with ChatGPT. ChatGPT is actually able to figure out what's going on with these folks.
Yes. So we have so many questions about this study that we invited one of these studies' authors. Dr. Rodman is an internist at Beth Israel Deaconess Medical Center in Massachusetts and the host of a medical history podcast called Bedside Rounds. Let's bring him in.
The doctor will see us now?
The doctor will see us now. Adam Rodman, welcome to Hard Fork.
Thank you guys for having me.
So let's talk about this study that you helped design. Tell us about the study and sort of what you were aiming to discover.
Yeah, so we were actually testing we were testing a simple hypothesis in a complicated way. That's what scientists do. We get too much into the details. But, one of the presuppositions in my field has been this idea that AI plus humans will always be better than AI alone, right? There's something essential about the humans. And a lot of health systems have rolled out these secure versions of ChatGPT, sometimes there's other language models, with the idea that it'll make doctors better. So we basically tested that hypothesis out. We did a randomized control trial where we gave doctors, we gave attending physicians and residents, so those are physicians in training, it was literally 50-50, and we either randomized them to go through these really complicated cases with ChatGPT or without. And we didn't just measure the diagnosis. We did, of course, measure whether they got the diagnosis, but we measure these really nuanced measures of how people think. So were you able to look for evidence that supported what you thought? Were you able to look for evidence that didn't support what you thought? Were you able to do these kind of basic cognitive tasks of a doctor?
What kind of information were you presenting to these doctors and these AI models? How detailed was it? The kind of thing that you would get in a medical school exam, or what kinds of problems were they being asked to solve?
Yeah, I want to see if we can solve some of them.
Yeah, I could. Do you want me to go through one of them for you?
Sure,
they're real cases. Yeah, you want?
Yeah.
Okay. I'm excited to hear you guys attempt to go through a medical case as we go.
I think it's scurvy.
Look, if there's one thing
I don't think any of them were scurvy, unfortunately.
If there's one thing we've learned about podcasts is that people love a medical mystery.
Yeah, this is basically like House MD, right? Okay.
Yeah, exactly.
Here you go. A 76-year-old man comes to his doctor complaining of pain in his back and thighs for 2 weeks. He has no pain sitting or lying, but walking causes severe pain in his lower back, buttocks, and calves. He has a fever. He's tired. He was told by his referring cardiologist that his recent test results, that since his pain started, he has a new anemia, so his blood levels are low, and he has renal failure. And then a few days before the onset of the pain, he had coronary angioplasty. So he had a coronary catheterization of his heart and opened a vessel, and he got heparin during that. And then we go over the lab values and stuff. This is not an easy case here. This is something that I think every doctor would know. Well, do you want to try to solve it first? Sorry, I should have.
My first thought was chlamydia.
No, post-cardiologist acquired chlamydia.
Exactly. Kevin, any thoughts?
I'm still going with scurvy here.
Okay, great. What was the real answer, Adam?
Cholesterol emboli syndrome, of course. I'm just kidding. It's actually a very hard diagnosis.
That was my second guess.
Yeah, second guess. Yeah.
Yeah, I mean, and the point is, none of the cases are what are called zebras, right? They're none of the things that are often on House MD. They're all things that are tricky to figure out, but you will see and are real. The purpose wasn't really whether or not the humans got the diagnosis, but whether they went through those steps that are essential and generalizable to getting any diagnosis.
So you give these little vignettes, these medical sort of mysteries to the doctors in the study, and the doctors are given the use of GPT-4 to try to help them diagnose and figure out what's going on with this patient. Then you also had just GPT-4 by itself with no help from human doctors try to analyze the same cases, and then you compared the analysis or the diagnosis from both groups. Is that right?
Exactly. And we also let them use any other resources they wanted.
And were these doctors in the study chosen because they had interest in using AI for diagnosis? Were they mostly sort of more tech-savvy doctors? Were they people who had used this stuff before?
No. So we did the classic trick to get a good subset of doctors is we paid them. So these doctors were everyone. They had been in practice for a variety amount of time. Some people were experienced ChatGPT users. Those were the minority. Some people had never used it before. Most people fell in between.
And what were the findings?
Yeah, so the findings were not the most optimistic if you want to make people better, which is that the AI model did not improve human performance. So humans using the AI model did about as well as humans alone. And then, of course, the finding that I think the reason that I'm here and that everyone is angry at me is that the AI model itself drastically outperformed both groups.
Yes, this was the headline, of a lot of the coverage about it was that the AI had beaten the doctors. Even if you gave the doctors access to AI, the AI by itself appears to do better at diagnosing these things. Now, obviously, we should make some caveats. This is a small study. We obviously would want more studies to sort of confirm this result. But this really stuck out to me because it seems like, sort of reading the study, what happened is that basically the human doctors did not believe the AI could be as good or better than them at diagnosing. And so they would go in and sort of second guess what the AI had said and end up getting the diagnosis wrong as a result. Is that consistent with the findings?
Yeah, I say there are maybe three reasons. Two reasons. So one, some people, despite the basic training, some people didn't quite know how to use a language model to get the most use out of it. So probably some of that is training. Number two, though, when we look at the data, people liked it when the AI model said, "Oh, this is your idea. These are the things that agree with it." But when the AI model said, "Hey, man, you might be wrong. These things don't fit," they disregarded that.
Here's why that resonates with me. Have you ever been in an Uber and they have the Google Maps open and Google Maps is like, you might want to take this route, and they say, no, I actually know a better way, and the next thing you know, it takes you an extra 30 minutes to get you wherever you were going? I firmly believe there is no Uber driver who can outsmart Google Maps, and we may be moving into a situation where most doctors cannot outsmart ChatGPT.
Well, and that brings us to reason number three, the reason that people are angry at me, which, I don't think it's the case now. It might be the case with O1, and it's certainly going to be the case in the next 1 to 2 years. Like, maybe AI models are better at making diagnoses than human doctors. I don't think that's the case with GPT-4 Turbo, which was the model that was used here, but it's going to be true at some point, and we're quickly approaching that.
Yeah, and we should say this study took place last year, right? So all of the models that doctors have access to are now almost, or they are 12 months better than they were, when you ran the study.
Yeah, this is the classic academic publishing lag. And of course, I'm talking about this trial now and doing really other cool stuff, but the models have continued to improve, especially in diagnostic domains. They're saturating our benchmarks, right? Everything that we can throw at them and we're like, this is what humans should accomplish. By the way, humans are like 45, 50%. The new models are like, well, just kidding, I'm 90%. So
I have a question about that, which is, ChatGPT released this O1 preview model, which does better reasoning. That's what they tell us. Yeah. And I have not been able to figure out any prompt that I, as a mere journalist, actually seem to have any need of it. As a doctor, are you already turning to this model for reasoning through difficult medical questions?
Yes, and I have a preprint that will come out in the next couple of days that shows how dramatic it is.
Yeah, the reason that this study caught my eye and fascinated me so much is that I think it's possible to imagine that a version of this finding could be found in many different fields. It's not just going to be medicine where the AI is sort of reaches a point where it is better than either the human practitioners in that field or the human practitioners using AI in that field. And I think when that point happens for many white collar sort of knowledge workers, there's this question of like, how do you as the practitioner react? Do you get defensive and say, oh, the AI has to be flawed, it couldn't possibly be better than me, I'm not going to use it? Do you rebel against the AI and say we can't, we these things make things up, they don't always get the thing right? Or do you embrace it and try to get good at the technology and use it in your work? Is that scenario playing out among doctors? Do you see doctors who are really happy about these findings because they say, oh man, we're going to be able to give patients such better care? Or do you think most of them are sort of reacting from a place of fear and confusion?
So yes, yes, and yes. Different people are reacting differently. Obviously, the reason that I'm doing this work is I want better care for my patients. And again, I like making diagnoses. I'm a huge nerd. I'm like the prototypical internist. I pace around my patient's room like a crazy person trying to figure out what's going on. But if this algorithm helps me take better care from them, I will give that up. Other people are resistant, to insult doctors a little bit. We're a profession that really prides ourselves on our cognitive abilities. It gives us a lot of societal power and power over our patients. And this is a professional challenge to my field. I am a pain in the butt, so that's fine. I don't care about that. But there are a lot of people that do. Right now, I'm at the Macy Foundation conference. It's all the top medical educators to try to figure out what AI means for how we train the next generation who's going to be practicing medicine for 30 years. These are things that the field is fiercely debating and arguing about right now. I'm just happy we're having the conversation.
Well, I have to say, I mean, the results are fascinating, but I do find myself siding in some ways with doctors who might be exasperated with these findings. And the reason is, Kevin, you and I say all the time, hey, don't bet your career on anything that a large language model is telling you. These things do hallucinate. They make up facts all of the time. You and I don't really use them in our work in the context of we look up a quick fact and just drop it into our story. We actually are always going to second guess the LLM. We're always going to try to find a second source before we're like, okay, we actually feel like we can trust this piece of information. And Adam, in your study, basically what you found is that people who did that, which we've been advocating for as a best practice, were worse at diagnosing diseases.
I know. It's really, to be clear, I was shocked at the results. My hypothesis going in was that people using it would be the best. So I am surprised by this. So the psychological literature on diagnosis, it kind of makes sense. It's not doctors. Humans are resistant to things that disagree with them, and we have all these heuristics and cognitive shortcuts that we take. So it's not surprising to me that what people did was they anchored on what they thought and what the first things that they thought, and they were resistant to something that was giving them a second opinion. Maybe that's something that's actually optimistic because we can align models or try to figure out how to present that information to make humans better. That is what I am trying to do, and I think all the short-term uses, let's be clear. If the headline is doctors are over, ChatGPT is good. No, absolutely not. There's a million things we do. This is just one part of it, and they're not capable of operating without us. I'm not discouraged by this. I'm still working to figure out ways we can use these technologies to make better care of our patients.
Yeah, I mean, that's the question I'm curious about is what can the medical field do? I mean, I'm imagining a future where patients have access to this stuff, and maybe before you go into the doctor to get your hip pain checked out, you do sort of an exhaustive prompting exercise with the model and say, hey, what is this? And then you sort of bring the readout from the AI into your doctor and say, hey, could you give me this medicine, and I need this operation because, and the doctor might say, well, let's do some tests. And you're just like, I don't need to. The AI already told me what to do.
That's already happening. I mean, there was a Kaiser Family Foundation survey on how many patients are putting their information, but it's already happened in my life when people will even put their, to be clear, these things are not HIPAA compliant. Please don't put any of your personal health information. But people are doing it.
Elon Musk told me I should be uploading all my MRIs to Grok. Are you saying he was not correct?
Well, it depends on if you want someone else to own all your MRI images. So yeah, keep that in mind.
Yeah, I uploaded it and it told me I had the woke mind virus. So that was weird.
They don't work very well.
Right.
But yeah, people are doing it already. I've had patients who do it. This is not a future. Now, does it work that well? Sometimes, but not consistently. And they're very, you have to prompt them right. But how far are we from somebody selling a commercial tool that's a doc in a box that works pretty well?
I mean, that is the actual implication of your study, is that you are better off just asking ChatGPT and not your doctor.
That's not my conclusion from the study, if that's what you want to take from it.
Well, the conclusion is basically 1 in 4 doctors were not able to successfully diagnose this, but in 92% of cases, ChatGPT did. Like, if I had to choose one of those 2 things, I'd probably choose ChatGPT, because it also does other things for me too. It's a lot cheaper.
I would say that the difference is that the people who put the case together, like the information, if you want to think about the prompts, were expert clinicians. We organized it in such a way, like you can imagine. I assume I don't want to talk about your past medical histories, but I've had problems, and humans don't always describe things the right way. We don't know how good ChatGPT is about getting that information out of us. I think it's going to happen, but I don't think that ChatGPT can do that now.
I'm curious if these AI tools do become part of the clinical model in hospitals all over the place, as it sounds like they are going to. What is it going to mean to be a good doctor in a world where AI is better at diagnosing than you are?
So I'll give you there's the darkest timeline, but we'll go with the optimistic timeline.
Give us both.
Okay, well, let's go with the optimistic view first, because this is what I'm hoping. And inspired by, I'm a huge nerd. This should not be a shocker, but inspired by you a little bit, Kevin, it's the Star Trek computer, right? So you have a computer system that's listening in at all times and is saying, hey, Adam, you might be showing some unconscious bias here. Adam, I think you should ask if this person makes their own snuff because eosinophilic pneumonia is on their differential. Like something that's listening in, cueing me to be better, trying to make me a better human, but also listening to the patient and getting more information from the patient. A computer system like that is something that makes the medical encounter more human, which I hope is what we want. You want the darkest timeline next?
Yes, please.
So, I don't know if you guys know this, so AI technologies are already being rapidly spread out in clinical care. They're listening to doctors' encounters with their patients. They're writing notes. They're writing the first drafts of like when you talk to your doctor on a portal of those messages. I just wrote a piece in the New England Journal of Medicine where I originally called it language models and the enshittification of the electronic medical record. It turns out the New England Journal of Medicine doesn't consider that an academic term, so they changed it to degradation. But what we're seeing so far is not the model that I am advocating for and what I'm researching and pushing for, but a system that's obsessed with efficiency, isn't really worried about some of the downstream effects on what this means for our relationships, and is just going to you'll get these more efficient tools, so you'll see twice the number of patients in a day. We'll just put this AI text in the chart so we can bill off of it, and a system that might use these powerful, efficient tools to squelch out the tiny bit of humanity that remains in medicine. So that, to me, is the darkest timeline and what I want to avoid. I don't think you have to engage with this technology. It's going to change every single white collar field. We're the ultimate white collar field. It's going to change our field. And I see a way that we end up with Dr. Crusher on the Enterprise, but I also see a way that we end up, I don't know, what's a dystopia? I'd say Blade Runner, but I don't think there are any doctors in Blade Runner, so this analogy is going to fall apart.
To me, an optimistic gloss on all of this is the upside in making this kind of care much more accessible, right? If all of a sudden I can just check my basic symptoms with ChatGPT, maybe that does provide me some benefit. Now, obviously, a lot of people have been doing this for decades with WebMD, and there are, sort of a lot of jokes about that. A lot of people are sort of quick to use WebMD to assume that they have the very worst condition, and also constantly seeking medical care can create its own set of problems. But if you're just sort of the median person, I can also just imagine checking in with my virtual doctor a couple of times a month to get some tips about how to live a healthier life.
And absolutely. We're not there yet, but I think that's the way things are going. And to be clear, the reality is terrible. How long does it take you guys to see your primary care doctor? I'm a doctor and it takes me forever. So maybe we'll have a system that can do those basic things, but also recognize when it needs to step you up, triage you appropriately. And maybe you'll have a system where instead of referring you to a specialist, your PCP will be able to work with that system to answer something that you would have needed a specialist before, or a system that says, hey, you don't need to go through the referral system, go straight to the orthopedic surgeon. So I think there's a lot of hope, and I acknowledge the baseline is terrible. Our medical system isn't really serving our patients, and if we're thoughtful about this, that's okay if my power is eroded. We'll get better care for everybody if we're thoughtful about it, which if you've looked at the history of how medicine has happened in this country, that's not always the case.
So I don't know, I'm curious. You're a doctor. You trained for many years to become a doctor. You amassed a lot of knowledge that has made you good at that job. What is your emotional reaction to the findings of your own study? Do you feel threatened by it?
Yeah, I mean, it's a lot of emotions, right? I'm both excited and I'm freaked out. I'm not the typical doctor. I am a historian. I deeply care about how people think. I feel like I'm on the edge of something new, which is exciting. But to me, like, I love talking to people. I love meeting new people. But one of the things that I love is the intellectual part of my work. That's what makes it. Like, I don't love sitting down and writing billing codes and saying, is this a level 2? I hate that part of my job. But the part where I get to like talk to somebody and figure out what's going on with them so I can make them better, that's my favorite part. But at the end of the day, I'm here for my patients. So that, like, I'm conflicted, but it's clear to me what the right thing to do is, which is do the right thing for the patient, even if it means giving up something that is dear to me.
Yeah. I mean, that strikes me as a good model for people in all kinds of industries. As the AIs do get better at doing our jobs, it seems like the North Star should be like, what is the actual work that I am performing? And if an AI can do that better than I can, then maybe that's better for the world.
Well, there is another approach that I wondered if you consider, which is to say that, essentially these chatbots were trained on a bunch of work that real doctors did. Those doctors are not being compensated. The primary effect of these chatbots being in the world is that the salary of a doctor could go way down. Has there been any talk among doctors of saying, let's actually get together and stop these things from draining all of the money out of our industry?
Oh, yeah, yes, those are. I think that in the grand scheme of things, that doctors are worried about threats to their career, this is low right now. These are all theoretical talks, but I suspect we're going to hear more of that. It's weird. Like, when you're in a profession, wait, am I allowed to swear on Hard Fork?
Yes.
Heck
Yeah,
yes.
I actually believe in that old bullshit about like the doctor-patient relationship being the most important thing above all else. I believe that. That's why I'm such a pain in the ass. So like, if this thing can do a better job than me at making my patient's life better, to me it seems like, regardless of those guild issues, right? It seems to me that's what the right thing to do is.
Yeah, it'll just be interesting if we live in a world where the actors have successfully prevented movie studios from replacing them with AI, but the doctors are like, well, I guess that's fine.
That might happen.
So after having done this study and continuing to do work in this area of AI and medicine, do you feel more optimistic about the future of medicine, or do you feel like we're headed into this kind of dark timeline where AI is just making all the decisions and we sort of suck the humanity out of the healthcare system?
I see the market forces at bear here, and my worry and the way that I see things being rolled out now is that we're veering not directly towards the darkest timeline, but that we're heading in that direction. And I think that we need to be really thoughtful. And the we is not just doctors, like patients need to have a voice in this also. This is ultimately who this is about what type of health system we want and how we want these technologies to be used. But I'm actually worried about us heading, like, the current timeline's pretty dark, guys. You get 5 minutes, 10 minutes with your doctor and they don't look at you and they type on the computer. Like, that's not good. So medical errors, like up to 800,000 Americans are killed or seriously injured each year because of medical errors. Every $1 out of $5 that Americans make go into the healthcare system. So this darkest timeline thing isn't that far away. And I'm a natural pessimist, but I'm trying. I'm like Don Quixote. I'm trying to go for the good timeline, even though it probably won't work.
If any young people are listening to this who may have been interested in becoming a doctor or entering the healthcare profession, what would you advise them? Should they not become doctors because AI is going to take that job?
Well, the problem is, what are you going to suggest that they do instead? Like, if we're talking about technologies that can do this, at this conference, they played something on Notebook LM with a fantastic podcast host. So I don't know. I don't. So I think that we're talking about tasks of doctors. that might be automated, and it's going to be working together for a while. And we're not talking about the job as a whole. And fundamentally, it's still a job about human connection and making people better. And if that is what you want, I would do that. Also, surgeons and proceduralists are not going anywhere. So I wouldn't dissuade somebody from medicine, but they should know that's what they're going into it for. And it's not going to be like Dr. House. I actually have never seen House. I always just use this example despite having never seen the show, so I'm phony. But it's not going to be that cognitive part. It's going to be something different. And that's scary because I can't predict. And I would love, medical students ask me this, and I don't have an answer for them.
Well, it's a fascinating conversation, Doctor, but I will be seeking a second opinion, actually. I think it's just important. That
you should ask ChatGPT.
All right. Thank you so much.
Thanks,
That was
guys.
great.
That was
Thank you,
fun.
Adam. Hey, that's the end of this clip. If you liked what you saw, head on over to our page and subscribe, and you can get the full podcast. We do a show like this almost every week on tech and the future. Head on over there now and subscribe.